Now, when a person is diagnosed with Alzheimer's disease and is introduced to the Alzheimer's community care family, they start a journey. The journey starts with the family nurse consultant, and it then moves through maybe specialized adult daycare and support groups and even advocacy on behalf of all families living with this horrible disease. Our next speaker is someone who can identify with all of this and even more. Please join me in welcoming Mr. Larry Butcher.
That movie does touch you a little bit, doesn't it? If you've actually been there and seen that rather than just seeing the video, it's even more touching. And when you have a loved one there, even more so. I want to thank you all for being here today. By being here, you're supporting one of the best, and in my opinion, the best organization of its kind in the United States, supporting those who are afflicted with Alzheimer's and importantly, their caregiver families. I served over 12 years as a board member of Alzheimer's Community Care, and I had the pleasure of being board chairman for a period of that time. Now, with that background, you would understand why I would stand up here and say nice things about Alzheimer's Community Care. A few of you may remember Paul Harvey, one of the best news commentators, I think, of all time. In the latter part of his career, he would dig into the backstory behind certain events, and he called it Now for the Rest of the Story. So now I'm going to give you the rest of my story. My wife Jeanette had been a teacher, an outstanding public speaker, a very supportive and loving wife, and a fantastic mother to our two sons. When we lived in Jefferson City, Missouri, she chaired the board of the March of Dimes. She was president of the citywide PTA. She served on the State Health Coordinating Council. She also served on the Bicentennial Committee. As an example of her activities, in 1973 she was voted Outstanding Young Woman of the Year out of a cast of 25 different women. We'd only lived in that town for 2 years. In 1980, we moved from Missouri to Boca Raton, where she served on the board of Boca Raton Academy. We moved to Stewart in 1983. She served on the YMCA board, the board of Safe Space, and the board of Second Sight, among other community activities. She began to show some unusual behavior in 1993. Actually, she was 53 years old. In 1995, I took her to Jacksonville, to Mayo Clinic, and she was diagnosed with an Alzheimer's-related disorder. The next 5 years became increasingly difficult. I semi-retired in January of 1996 and fully retired in January of 99 to become her full-time caregiver. By the end of 99, I was at the end of my rope. I didn't know what to do. I reached out to other organizations. I reached out to people. I had conversations with her doctors and got very little help. And just by chance, one day I was driving down Federal Highway in Stewart and saw a sign that said Alzheimer's Community Care. I immediately went into the office, excuse me, met the family nurse consultant, and she literally put her arms around me and set me down, and we started looking at a model of care for my wife and for me. She mentioned the caregiver support group. Now, I have to say that I wasn't really interested in that at the time, to go into a support group and hear a lot of old people talking about the problems they're having with their loved ones. But I went. And I ultimately became the facilitator for that support group for the next 10 years. In that group, I learned so much about the differing symptoms of the Alzheimer's patient. As we say often, If you've known one, you've known one, because the symptoms present many times so much differently. But I learned a lot about that. I also learned a lot from the caregivers that were in that group. That group was 20 to 25 people at times, and it was fantastic. The family nurse consultant also mentioned the specialized daycare program. So early in 2000, my wife attended one of those day centers. That gave me some much needed rest that I hadn't had for 5 years. It gave me a break. I could go do something on my own. The problem was she was advancing very fast. And on November 7th, 2000, that's a date that many of you in Florida remember as the famous Hanging Shad Election Day. My memories are more difficult than that, because after 4 years of dating, 40 years of marriage, I had to give up being with someone that was very special to me. That day I placed her in a nursing home. At that time, she didn't know where she was. She didn't know who I was. Even the nursing home had difficulty handling her, and then only 3 months later in January, they called me and said they couldn't keep her anymore. So what's that leave it up to me to handle her? They suggested I take her to the Savannah Psychiatric Hospital in Port St. Lucie. Now that's not really appropriate for an Alzheimer's patient. So I had considerable arguments with the head psychiatrist at the hospital until we determined a treatment plan. I had known this lady since she was 16. If she had a headache, she took half an aspirin. If she had one drink, she would feel it. So I knew that if I took her in there, they were going to give her some heavy drugs, and she'd probably end up being a zombie. But the psychiatrist worked with me, and he started on 1/4 dosage of whatever they would normally give and titrated up until they had her under control. In 10 days, we got her back in the nursing home. She spent the last 9 years of her life there. She passed away in 2009. I'm here to tell you I would not have made it without the care and support of Alzheimer's Community Care. I was so impressed with their model of care that I joined the board of directors in order to hopefully help others who were suffering from my same circumstances. Alzheimer's Community Care gave me a voice as an advocate for those affected with Alzheimer's disease and their caregiver families. I was appointed by then Governor Bush in 2003 as a member of the State of Florida ADI Committee, a state advisory board for Alzheimer's disease. I had the opportunity to chair that committee as well for a couple of years. In March of 2009, the former Florida U.S. Senator Mel Martinez asked me to testify at a special Senate committee hearing in Washington, D.C. It was a hearing to discuss the National Alzheimer's Project. Now, I have to admit, the following morning, Diane Sawyer announced on Good Morning America that the famous and not so famous appeared in Washington, D.C. yesterday testifying on the Alzheimer's Project. Our panel was Sandra Day O'Connor, Supreme Court Justice; Newt Gingrich, former Speaker of the U.S. House of Representatives; Bob Kerrey, former Senator from Nebraska; and Maria Shriver. And the not so famous was me. I had the opportunity to speak after Maria Shriver, who, as you know, is an award-winning journalist. That became very difficult. Even Senator Cole, the chairman of the committee, said, "Mr. Butcher, you have a tough act to follow." And it surely was. But I had the opportunity to tell them about the efforts and the successes of Alzheimer's Community Care. You may think what I said today is a lot about me and my wife. I can assure you it's my story, but it's really the story of Alzheimer's Community Care. Unfortunately, the federal government has yet to recognize the real seriousness of the growing population afflicted by Alzheimer's disease as the patient or the caregiver families. Some statistics that you may hear is there are 5 million people in the United States suffering from Alzheimer's disease. That's the same number they've been quoting since 1995. I think it's grossly understated. After working with Alzheimer's groups in Florida and in some other areas, it really gives me an understanding that that figure is understated. Last year, government statistics reported that there were 60,000 people who died from Alzheimer's or related dementia. Government statistics also report that Alzheimer's is the 6th leading cause of death in the United States. There's a fallacy in that also. Many deaths from Alzheimer's patients are reported as something else. My own wife's death certificate says cause of death, aspiration pneumonia. Now you know the rest of the story. Now you know why I praise Alzheimer's Community Care. There's staff on the ground here to help you, help ease the transition through this dread disease for the patients and also their caregivers. There are other organizations out there that are constantly raising money for research, for a cure to this disease. I've been waiting 26 years. I hope someday they're successful and that they can put, by being successful and eliminating this disease, we can put Alzheimer's Community Care out of business. But in the meantime, I'm extremely glad for Alzheimer's Community Care. At almost 81 years old, I'm a little wrinkled, much like the crumpled wrapping paper that we end up with after we open our Christmas gifts. But we don't remember the wrapping paper. I'm reminded of the gifts that were inside, the time that I had to spend with my beautiful wife, and the help that I got from Alzheimer's Community Care. Where there's help, there's hope. Alzheimer's Community Care is here to help. Thank you for being here to help.
Thank you, Larry, so much for sharing that story, Larry Butcher.